The mass migration of the nation's healthcare professionals has sadly been the norm over the last several decades, with greener and better pastures offshore and elsewhere. Oddly enough, this trend is on the turnaround thanks to government's ramped-up efforts to keep these homegrown gems that are the industry's gold standard here at home, with better pay, perks, and benefits on the back end. Our Alan Francisco on the details of today's health sector huddle with the President.
Provision of additional healthcare subsidies, housing, and education programs for Filipino nurses who choose to work in the country despite more financially rewarding opportunities abroad. This was stated by Health Secretary Teodoro Herbosa in a press briefing earlier at Malacanang following their sectoral meeting with President Ferdinand R. Marcos Jr.
Very soon, announce namin na we are actually allocating with DBM money to get health insurance. So may subsidy na ibibigay, maliit lang pero it will allow them to get health insurance for themselves and even their family. So may PhilHealth na sila, they can get health insurance. The other one I'm doing is trying to provide housing for our healthcare nurses.
For publicly employed nurses, Herbosa said they can apply for housing loans through Pag-ibig. The government is also focused on programs to prevent widespread illnesses among Filipinos. This includes Bukas Centers or the Bagong Urgent Care and Ambulatory Services, which focuses on the improvement of hospital services and treatment, and particularly on women's health.
The President agreed with the program on promotive healthcare. There's also the fact that we also can do prevention. So ito yung mga vaccination, yung other things that you can do.
The government will also establish health facilities in 5 island tourist spots: Coron, El Nido, Siargao, Panglao, and Boracay. The DOH will also study the implementation of floating clinics in the local governments in the other islands.
Some are proposing to have floating clinics in our island LGUs. Your reaction on that, sir?
Yeah, kasi na-announce ko yung mobile clinics that will be launched soon. So we have the first deliveries of this. Yung mobile clinic, may x-ray, may ultrasound, may hematology, chemistry, and then may sariling generator. Paikutin natin to sa mga communities, and we procured about 83 of these, and this will be delivered in batches.
Under President Marcos' administration, Secretary Herbosa said state universities and colleges are producing more medical professionals than ever. The Department of Health is also focused on the rising cases of HIV, with the youngest infected being 15 years old.
So I actually had a meeting with Sarah, Secretary Sarah, because we need to educate our youth. They're more experiment and curious.
Alan Francisco from the National TV Network for a New and Better Philippines.